Hi everyone. One of the growing concern about women's health is cancer, and many of us are not aware from this. Dr. Sagu from Apollo Spectra Hospital made me understand the importance of health checkup in this.
Breast cancer is the number one cancer in Indian women, and unfortunately, the incidence is rising rapidly in India because women are coming at a more advanced stage, and more younger women are getting affected with this disease. And the most common symptom of a breast cancer is a painless lump in the breast. The second symptom can be a nipple discharge. Normally, the nipple discharge, which happens from both the breast, or it is milky in nature, or it is greenish in color, is normal. But if the nipple discharge happens from a single duct and from one side of the breast, then it should be evaluated. And if it is reddish in color and or it is clear white in color, so this can be a sign of a locally advanced breast cancer, or this can be a sign of early breast cancer like DCIS and all. Third symptom, there can be any sudden change in the size or shape of one breast. Sometimes one breast becomes very large, or one breast becomes completely small and shrunken. So this should also be evaluated. And fourth, the sign of locally advanced breast cancer, there can be the thickening of the skin or dimpling of the skin, some ulceration over the skin, or some redness over whole of the skin of the breast should also not be ignored. Breast cancer can be detected early. Number one is breast self-examination. All women can learn this method and do it at home. Second method to detect breast cancer early, which is now becoming very common in India, especially a developing country like India, is a clinical examination by a doctor. So women who are above 30 years of age are advised to go to a specialist or a healthcare professional who are trained in doing the clinical examination and get themselves examined once a year. Yes, the main aim of preventive healthcare in women is to promote health and to prevent the diseases. And this can be achieved by assessing the four parameters. One is knowing the risk factors in the family, personal history, any mutations in the family, any history of chronic diseases in the family. Second is getting regular screenings annually. Okay. And the third is getting the vaccinations, even in the adults, like flu shots and all. And fourth one is getting counseling for diet and exercise. The cervical cancer is actually caused by a virus. The name of the virus is human papillomavirus. It has several strains, but two strains are very common, like strain number 16 and 18, which are responsible for causing this disease. And this is actually a sexually transmitted disease. And the women who are at risk are who have multiple partners, or their husbands have multiple partners, or they do not practice safe sex, they do not use condoms, or history of smoking, or lower immunity. So these are some of the risk factors which increases the risk of having cervical cancer. Okay. Ma'am, what is the best treatment for cervical cancer? Actually, it is a multimodality treatment. If the cervical cancer is detected in a pre-cancerous stage, then just the treatment is very simple. Just remove that part of that area, and that's it. And if it is early stage one, sometimes surgery is effective. If it is a locally advanced disease, then radiation is more effective. If it becomes a metastatic disease, then we combine it with the chemotherapy also. So the treatment all depends on the stage of the disease at which woman comes to us. Okay. And ma'am, what is the best time to take cervical cancer vaccine? Yes, this is a good question. In India, we have two strains of cervical cancer vaccine. One is Cervarix and second is Gardasil. And this is given in 3 doses, that is 0, 2, and at 6 months. And the best age is actually 9 to 16 years. That is before starting of the sexual activity in girls. But nowadays we are giving up till age of 45 years of age also. Okay. जैसा कि हम सब जानते हैं कि औरतों में दो कैंसर बहुत कॉमन है, एक है ब्रेस्ट कैंसर और दूसरा है सर्विकल कैंसर। और इन दोनों कैंसर से बचा जा सकता है, इनको कम्प्लीटली क्योर किया जा सकता है और इनको स्क्रीनिंग टेस्ट से जल्दी डिटेक्ट किया जा सकता है। ज़रूरत किस चीज़ की है? ज़रूरत है अवेयरनेस की। जितना हम अवेयर होंगे कि हमारे शरीर के लिए ये टेस्ट ज़रूरी हैं, इस एज के लिए ये टेस्ट ज़रूरी है, इसके क्या-क्या शुरुआती लक्षण होते हैं, इनको हम कैसे जल्दी डिटेक्ट कर सकते हैं, क्योंकि ये कैंसर ऐसे हैं, महिला खुद ही इनको डायग्नोज़ कर सकती है। कोई आपको जाकर नहीं बताएगा कि आपकी ब्रेस्ट में गाँठ पैदा हो गई है या आपके पीरियड्स इर्रेगुलर हो गए हैं। ये आप खुद ही इसकी जांच कर सकते हो, आप खुद ही इसको टेस्ट कर सकते हो। जैसा कि मैंने बताया, ब्रेस्ट सेल्फ एग्जामिनेशन से आप अपने ब्रेस्ट को टटोल सकते हो कि उसमें कोई गुठली या कोई सिम्टम और नया तो पैदा नहीं हो रहा है। और अगर पैदा हो रहा है तो उससे घबराएं नहीं, डरने की ज़रूरत नहीं है, उसकी जांच करवाएं, ताकि अगर उसमें कैंसर है तो वो जल्दी से ठीक हो जाएगा, और अगर कैंसर नहीं है तो फिर तो घबराने की बिल्कुल भी बात नहीं है। इसी तरह सर्वाइकल कैंसर के लिए मैं सबको ये एक इम्पॉर्टेंट मैसेज देना चाहती हूँ कि लड़कियों को सर्वाइकल कैंसर वैक्सीन ज़रूर लगवाएं। ये बहुत ही फ़ायदेमंद है, इससे हम सर्वाइकल कैंसर को कम्प्लीटली इरेडिकेट कर सकते हैं। सर्वाइकल कैंसर वैक्सीन ज़्यादा महंगा नहीं है, अभी तो 2-3 हज़ार का मिलता है, लेकिन गवर्नमेंट, इंडियन गवर्नमेंट, अभी मोदी जी ने हमें ये इंजेक्शन हमारे इम्यूनाइजेशन स्केड्यूल में भी लाने वाले हैं, जहाँ पर ये वैक्सीन 200 या 300 रुपये में मिलेगा। तो प्लीज़ लड़कियों को ये वैक्सीन लगवाएं, और जिन्होंने वैक्सीन नहीं भी लगवाया है या लगवाया है, वो पैप स्मीयर ज़रूर करवाते रहें 3 साल में एक बार, और एचपीवी डीएनए टेस्ट 5 साल में एक बार। ये कैंसर शुरू होने से पहले जो प्री कैंसरस चेंजेस होते हैं या इन्फ्लेमेटरी चेंजेस होती है सर्विक्स में, उसके बारे में हमें बताते हैं, ताकि हम उसका आसानी से इलाज कर सकें।
थैंक यू सो मच मैम फॉर दिस इंसाइटफुल सेशन। आई होप मेरे फॉलोअर्स को बहुत हेल्प मिलेगी।